Today we're going to be doing extension of the hallux and toe of MP and IP extension. So the muscles involved are going to be the extensor digitorum brevis. It originates on the calcaneus anterior superlateral surface, the lateral talocalcaneal ligament, extensor retinaculum inferior, and it inserts in the ends of the foretendon of the hallux, proximal phalanx dorsal surface, may be named extensor hallucis brevis. Toes 2 through 4 join tendons of extensor digitorum longus lateral sides, along with 2 more muscles, which are the extensor hallucis longus, and it originates in the fibula of the interosseous membrane and inserts in the distal phalanx of the great toe. And we also have extensor digitorum longus, and that is originating in the fibula, interosseous membrane and tibia, and inserts in distal phalanx of the 4 lesser toes, and they are innervated by the deep fibular nerve.
So today we're going to be doing manual muscle testing for hallux and toe, MP and IP extension. So first we're going to start with the lateral toes. So you just want your patient sitting with their foot on the therapist's lap, or you can also have them supine with the ankle in neutral. So here we have our patient with their foot on my lap, and I'm just sitting on a low stool in front of her, or if you had them on the table, then you'd be standing beside them near the foot. So to test for the toes, you're gonna have one hand stabilizing the metatarsals with the fingers on the plantar surface and the thumb on the dorsum of the foot. And then the other hand is used to give resistance with the thumb placed over the dorsal surface of the proximal phalanges of the toes. So testing the toes here, I'm just gonna ask your patient to straighten your toes and hold it. Perfect, so that would be a grade 3. And now to apply resistance, just using my thumbs here. So straighten your toes, hold it, don't let me push down. Perfect. So that would be for grades 4 and 5 testing. So for grades 4 and 5, they can extend their toes fully against variable resistance. So max resistance would be grade 5 and moderate would be grade 4. So now moving to grade 2, they can complete the range of motion with grade 3 would be they can complete the range of motion with no resistance, and 2 would just be a partial range. 1 and 0, you're just palpating for the tendons of the extensor digitorum longus, which can be palpated or observed over the dorsum of the metatarsals. And the tendon of the extensor digitorum brevis can often be palpated on the lateral side of the dorsum of the foot, just in front of the malleolus. And so palpable contractile activity would be a grade 1, no contractile activity would be a grade 0. And to test for the hallux, I'm going to stabilize at the heel and just use my thumb. So same thing, straighten your big toe out for me. Perfect, so that would be grade 3. And now applying resistance, just using my thumb. Hold it there, don't let me move you down. Excellent, so that would be for grades 4 and 5. 5 being max resistance, 4 being moderate resistance. And same thing, grade 2 would be partial range. 1, just looking for contractile activity. 0 would be no contractile activity.